Hello and welcome to Radio Zindagi 1170 AM. I'm RJ Vijaya. And today we have a very special conversation for you, all about matters of the heart. Because simply put, the heart matters. But for us South Asians, romancing the heart is a serious proposition given the grim statistics. Majority of the world's heart patients are projected to be South Asian in the next few years. 50% of heart attacks occur at ages less than 55 years. And we South Asians develop the disease 10 to 15 years earlier than any other ethnic group. Shocking, isn't it? Why does this happen and what can we do about it? Well, I am happily privileged today to have as my guest one of the leading lights in the field of cardiology from the Mayo Clinic in Arizona. And Dr. Komandur Srivatsan joins me. Hello, Dr. Srivatsan. So great to have you here.
Yes, hi, Vijay. How are you?
I'm doing very well, and thank you so much for doing this. It's really great community service on your part.
Sure, thank you.
So let's get cracking on this. Why are we predisposed to heart disease?
Yes, I think, well, hello to all the viewers. The South Indians or Indians in general have smaller caliber blood vessels to begin with. You know,
The
the
South
diameter,
Asians.
yes, the South Asians,
Okay.
the diameter of the blood vessels on an average on Indians is around 2 to 2.5 millimeters, whereas it's about 3.5 to 4.5 among Caucasians. So it is easy to block a narrow pipe, which in turn can lead to a heart attack.
Mm-hmm.
In addition, our lipid profile, which we routinely measure on an annual or every 5-year basis with your physician,
Mm-hmm.
has a disadvantage for South Asians. Particularly if you look at, you would have gotten your lipid profile, it would show good cholesterol as HDL, the bad cholesterol as LDL, and then triglycerides as a measure of how much fat is in the blood.
Mm-hmm.
If you look at that, the HDL, the good cholesterol, is significantly lower in South Asians. The bad cholesterol, LDL, is elevated,
Oh.
and the triglycerides are generally elevated because many of us are pre-diabetics to
Mm-hmm.
begin with. And intriguingly, there is a molecule called LP little a, which is a tiny fraction of the LDL for majority of the Caucasians. It's in the 20s or 15.
Mm-hmm.
And for us, it runs between 60 to 120. And this is a smaller diameter molecule which is able to penetrate through the
Mm-hmm.
inner lining of the blood vessels and deposit on the wall and form atherosclerosis or hardening of the arteries. So
Mm-hmm.
clearly we seem to be predisposed to more heart attacks at a younger age than our peers of Caucasians or other races.
Mm-hmm. That's pretty disturbing right there. But so today we are all in lockdown and we're disconnected from our routine in some sense. So we have a little bit of time to introspect. And so I was wondering if you could really guide us on what we could do to avoid this kind of thing going forward and how we could boost our heart health really.
Yeah. The first thing is that why genetically we're abnormal is because of years of the millions of years in human race in South Asia. We've gone through famine and floods and so on. So we seem to absorb every morsel of food that we eat,
Uh-huh.
unlike the plentiful food nature of Norway or Sweden. So
Yes.
that's one of the reasons why our LP little a is pretty high.
Uh-huh.
The second thing is we have adapted from a culture where we need to be active, but because almost all South Asians who are successful or forced to be successful at a young age make to read a lot of books, and physical activity and physical exercise is somewhat minimal or reduced.
Mm-hmm.
So, and thirdly, we have a very high carbohydrate meal, carbohydrate rich meal,
Oh.
which means we end up having carbohydrates cannot be stored as carbohydrates. They're converted to fat in the body, and the fat is stored in under the skin, but majority of the time it is stored around the belly. And so it is these kind of sources of energy which we store we from
Mm-hmm.
our dietary habits are a couple of the reasons why we are really prone for a lot more heart attacks. Now,
Mm-hmm.
the important thing is as we move to the United States and we live in a different milieu, we need to readjust our lifestyle, especially when we have these kind of shelter at home kind of a situation from COVID. We
Yes.
really have to find ways to spend the energy.
Mm-hmm. Actually, it's the other way around these days. Like people have sort of lost track of, the regular routines of exercise, and they're like eating and grazing all day long. So it's sort of contributing to the problem now.
Yeah, I mean, by going to an office, you park your car, you walk and go to the cafeteria, walk with
Yes.
colleagues and talk, and such interactions have stopped, and walking has really minimized, and the gyms are not open.
Yes.
So realistically, first thing to do perhaps is to buy a standing desk at home
Uh-huh.
rather than sitting down and working on a laptop or a computer. It's better to buy a standing desk.
Yeah.
And if you're really keen on exercising and you're not getting any other form of exercise, it's not unreasonable to buy a treadmill desk.
Oh, okay.
So the treadmill desk will move around zero point 0.5 to zero point 0.7 miles so that you can still do surfing, typing, and everything you can do, but your
Mhm.
feet is not stationary and you're not sitting in one place. You would be surprised if you're doing a 3 hour treadmill at zero point 0.5 miles per hour, you would still have a far more cardiovascular benefit than just simply sitting. It
Mm-hmm.
is not a workout to make you. There are two things we have to realize: that the cardiovascular exercise and how to look good exercise. Those are two different things.
They're different,
Oh,
exclusive.
sure.
Oh,
The
okay.
cardiovascular benefits come from just 30 minutes of walking,
Huh.
brisk walking at 3.5 to 4 miles per hour, depending upon your age and ability.
Yeah.
But looking good is a lot of weightlifting, and that is actually cardiovascularly not that protective. In fact, can raise your blood pressure. So
Uh-huh.
that's having a six pack is not cardiovascularly uh, that healthy, but definitely just movement is
Mm-hmm.
critical.
Right.
10,000 steps a day by American Heart recommendation is absolutely essential for good
Mm-hmm.
health. And it's not easy with if you're sheltering at home.
Yes, yes. Though people do get out a little bit in their neighborhoods, but
Yeah.
then they're affected by the pollen right there. So
Yes, luckily.
either way, they're sitting
Yeah,
down.
luckily the cloth mask is good enough to filter the pollen. The regular medical masks are capable of filtering bacteria.
Mm-hmm.
The N95 has pores enough size to really filter the viruses.
Uh-huh.
So one should really, depending upon the situation, but if you wear a cloth mask, bulk of the large particles will be filtered.
Will be filtered. Oh, good to know. Good to
Yeah.
know. So, diabetes is another major issue. 1 in 3 Indians is diagnosed with diabetes. So, what can we do about this? Can lifestyle changes really help to cut the incidence of diabetes or stop it in its tracks?
Yes, absolutely. You see, the majority of the Indians have type 2 diabetes,
Mm-hmm.
not type 1 diabetes, where insulin is not made at all. And therefore, you have starts at a very young age, and insulin is required from the very day one. And if you don't take it, you'll end up in dangerous unconscious state called diabetic ketoacidosis. But
Mm-hmm.
what we're dealing with is vast majority of us produce enough insulin, and in fact more insulin, but we're not able to push the glucose into the cell where
Uh-huh.
the insulin has to lock on the cell surface receptor like a lock and key and push the glucose into the cell.
Mm-hmm.
That does not seem to happen because we have so much fat disproportionately compared to muscle. Muscle tissue has much more insulin receptors per unit area
Mm-hmm.
compared to fat cells.
Mm-hmm.
The reason why we have fat is because we have a lot of unspent carbohydrates that we eat. So it's like a bank deposit. If you keep depositing and not withdrawing, it is going to accumulate.
Mhm.
And carbohydrates, because they only give about 4 kilocalories per gram, whereas fat can give you 9 kilocalories per gram. Body thinks it is better to have a higher storage form with lower volume occupied compared to carbohydrate, which is stored
Mhm.
as glycogen in the liver temporarily. If you skip a meal, supposing you're to have lunch at 12, but you're having it at 3 o'clock, the glycogen is useful. But if
Mhm.
you starve for more than 10, 12, 18 hours, it's a fat that is mobilized, and it takes about a week for the protein to be broken down for energy consumption. So, because we eat a lot of rice or wheat based, whether we have paradas or whether we have rice,
Mhm.
and of course, I am from Chennai where we eat 3 courses of rice for every meal,
Yes.
both the
Right.
sambar, rasam, and yogurt. And so that amount of carbohydrate intake with polished rice, these days machine polished, is not hand pounded and not parboiled. So that ends up having I'm having 2,400 kilocalorie diet a day, of which 1,900 to 2,000 is coming from carbohydrates. And I cannot possibly spend. One thing is you cannot exercise enough to spend all the calories you eat.
Mhm.
So it is actually, if you want to lose weight, dieting is far more critical than exercise. Cardiovascularly, you get 30 minutes of workout, you're good.
Yeah.
But on the other hand, the amount of carbohydrates that we eat is far in excess of the energy that we can spend. A 30-minute workout will burn about 125 kilocalories.
Right. So
And
so are you saying low carb is the way to go and
absolutely, yes.
mhm.
Low carb and protein rich.
Mhm.
And the fat is mostly for satiety. I mean, I know in the old days they used to put a lot of ghee in. It's not that bad as we think. The
Mhm.
reason is that ghee has a delayed gastric emptying time,
Mm.
which means you're not going to feel hungry too quickly.
Ah, okay.
Same thing with the butter. I mean,
Right.
if you eat real polished rice and sambar with very little dal, dal takes a little longer time to digest.
Mhm.
So you're going to feel hungry within 2 hours and 3 hours, and having a snack with a bonda or
Mhm.
tea with sugar. I mean, that means we're just pounding more and more calories, which all have to be stored somewhere.
Right.
And that's where it's stored largely around the trunk
Uh-huh.
because there's a large area available.
Yeah.
And once you have such degree of insulation, we're talking of there are patients whom we operate and find we're going through about 4 or 5 inches of fat before we see the muscle.
Mm.
And if you say the abdomen occupies about 30 to 40% of body surface area, you
Mm.
can see the amount of fat we have to get through to get to the muscle. So that is insulin resistance. You can have a lot of circulating insulin, but they won't be able to have their actions because the fat cells lack the number of insulin receptors to
Uh-huh.
push the glucose in.
I
So
see.
what happens is disproportionately higher amount of insulin per unit amount of glucose. And in fact, this is interesting that we've done some studies and there are published studies that show that for, let us say, 120 milligrams of glucose per deciliter in the blood measured, an average American or Caucasian race has about 3 picograms of insulin,
Mhm.
whereas the Indian has 9 picograms of insulin because the insulin is not able to have the desired effect with it because there's not enough muscle.
Oh.
And
Huh.
when you raise the insulin, insulin is an anabolic hormone. It tends to promote growth
Mhm.
and it promotes the inner lining of the blood vessel growth, which in turn clogs up the blood vessels. So we
Ah.
really have to have more muscle mass and reduce fat mass.
Mhm.
If your fat mass is below the 25%, you're in really good shape. Of course, athletes have in single digits,
Mm.
but that's not what we're aiming. Somewhere less than 30% would be appropriate.
Right.
Fortunately, vast majority of South Asians are in the 40 to 45% range, which
Mhm.
is quite in excess of what is recommended.
So what's your view on the intermittent fasting fad, which is just, going on these days?
Yeah, it's actually not a bad idea.
Uh-huh.
There are several ways of doing it. Some people do this 18-hour window every day and eat within 6 hours. And some people eat for 6 days and fast one day. I
Mm-hmm.
personally think fasting one day is better than 18 hours
Mm.
because the experiments have shown that what insulin like growth factor 1, which is what eventually clogs up blood vessels, dramatically drops if
Mm-hmm.
you fast for 24 hours.
Oh,
Whereas
okay.
with intermittent fasting, it drops about 50. I mean, with the daily fasting for 18 hours and then eating only for 6 hours, it drops
Mm.
about 50%. So
Mm-hmm.
it is still beneficial either way. This is why I think our forefathers had this Ubavas day,
Yes.
one day they won't eat, which is a very good idea. If you can drink water and eat a very light meal or something to sustain yourself, you deplete the amount of fat storage quite significantly, reduce the amount of abnormal hormone changes that take place in the body. And really, it's useful. I don't know as a weight loss tool.
Mm.
It is once a week fasting won't work because if you
Mm-hmm.
gorge the other 6 days, you won't go down. So you still have to monitor your calories and so on. Even whether you eat 6 hours or 7 hours, it doesn't mean in 6 hours you can eat 5,000 calories and expect to lose weight.
Right.
But you can eat in moderation and fast. It's certainly the abnormal effects on blood vessels will reduce over
Mm-hmm.
time.
Wow. Wow, that's amazing. You really put it so well. I didn't realize that they had so much, implications. And then coming to salt, salt is one of those three weapons of mass destruction along with sugar and fat.
Sure.
So, and it's also having damaging effects and related to blood pressure, high blood pressure. So,
Yes.
if you could
Oh.
shed some light on that.
Oh, absolutely. Among South Asians, it's a huge problem. It's not uncommon in South Asia for people to have yogurt rice with pickle. Each pickle contains about 4 grams of salt.
Whoa.
And on average, we consume about 8 grams of salt with a South Asian diet. And unfortunately, we live in 24/7 air conditioning in the United States. It's very hard for us to go out and really break a sweat.
Mm.
But if, for example, I'm from Chennai, where if you just have to take a shower and come out of the shower, you feel like the sweat comes out immediately.
Yes.
So the salt comes out of your body through the sweat glands in the tropics. But here we're in temperate climates or conditioned climates where we have hardly have any sweating. We turn the AC on in the car, in the house, in the office, and hardly we expose ourselves to even if they're in the summer, to the heat. And of
Mm-hmm.
course, in the winter, it's impossible to sweat. So it becomes really difficult to get rid of the salt that we are used to eating in South India or South Asia and translate it to the United States.
Mm-hmm.
So we really need to eat only 1.5 grams of salt.
Oh.
And that is 1.5 grams of sodium. That is about 3 grams, approximately 3 grams of sodium chloride. So
Mm-hmm.
really, we have to modulate our diet to a lower degree of salt. It's interestingly, one can easily train the palate
Mm.
to eat lower degree of salt and get
Mm-hmm.
used to it as the nominal salt for your body, because the front two-thirds of the tongue, which perceive the salt sensation, over time readjust to the newer level of
Oh.
salt, and the food would taste fine.
Yeah.
It is just that adjustment phase when you drop from the 8 grams to the
Two
three
third.
grams or
Mm-hmm.
the 1.5 grams of sodium that
Yeah.
you feel, oh, this food doesn't taste good. I felt so much better. It is, if you give in a lean-in period of 10 days to 2 weeks, you'll get used to the new level of salt,
Mm-hmm.
and your blood pressure will precipitously decline.
Mm-hmm.
Now, what we're doing as doctors
Yes.
is giving people diuretics, basically hydrochlorothiazide or chlorothalidone,
Mm.
which really gets rid of 2 grams of salt. And so, what we're trying to beat the system is eat more salt for the tongue, for the taste of the food, and get rid of it by taking a diuretic. But we could not have challenged the system to begin with
Mm-hmm.
had we taken less amount of salt. I think of course, people who eat preserved meat, in addition to vegetarians, we eat pickles and sambar and and any vegetable in, because part of the problem is we put a lot of spice.
Yes.
And when we put a lot of spice, we need to put more salt.
Salt. Right.
I mean,
Right.
if you can get rid of the amount of spice in the diet, then the salt will go down, and
Yeah.
overall the health will definitely improve quite significantly.
Right, right. Excellent, excellent. So would you like to, I know you've given us so many things to think about, food for thought, as it were, but any tips that you'd like to leave with the community as, going forward and watching their health?
Yeah, I mean, clearly they have to eat a little less calories than, and if 1,800 calories is enough for most of us who are not overly active,
Mm-hmm.
unless you have any one of the variables which gives you the amount of calories that you spend. You have a basal metabolic rate by simply sitting in one place and breathing and doing things. You would spend some calories, which could vary depending upon the weight of the individual, somewhere between 600 to 1,000.
Mm-hmm.
Your activity level is the next. So if you are one of those couch potatoes, you're talking of 600, 800 kilocalories is all you're going to spend. If you're going to be hyperactive, you can spend up to 1,500 calories. So your nominal diet is going to range between 1,500 to 1,800 calories. If
Mm-hmm.
your diet is going to be in excess of any of these, you're going to accumulate and then cause diabetes because of high fat content. And if you take a lot of salt, you have diabetes, hypertension. Now
Mm-hmm.
you have obesity,
Yeah.
predisposition, genetic predisposition because of lipid profile, which we talked about. Then you have mixed with diabetes and hypertension. We're really asking for trouble at an younger age.
Yes.
So to prevent all this, we must really start being active and modulate our diet to the new changed circumstances in the United States.
Mm-hmm. Mm-hmm. Wonderful. So it's all about eating less and moving more.
Yes,
That's what it's all
absolutely.
about, right?
That's well
So
said. Yeah.
so that's excellent. And you've been sort of on the front lines of the COVID crisis where you are in Arizona,
Mhm.
despite being a cardiologist. So what's
Mhm.
been your observation there?
Yeah, the COVID epidemic, the virus itself is a novel virus because it has spike proteins, which are that's what gives you the sun ray appearance of the virus. Many of you would have seen on TV, and that protein is kind of new to this human beings because it's never been exposed. So we mount an exuberant response, immune response, which is what is probably proving to be lethal
Mm-hmm.
in about 5% of people who come to the ICU. In fact, the other day we had to put a temporary pacemaker because it inflames the heart muscle in addition to damaging the lungs. We've had about 75 patients in our hospital for the whole duration. We had about 9 or 10 on ventilator at a given time each week. We had one or two at significant degree of myocardial inflammation.
Mm-hmm.
We are using the IL-6 inhibitor as well as the remdesivir and hydroxychloroquine until recently. I think, except for one lady, most of them have done well.
Mm-hmm.
But the most important thing is because there's no vaccination, we just need to make sure we maintain the safe social distance, wear our mask all the time, and wash our hands frequently to get rid of the virus so that we don't end up in the hospital to begin with. I
Mm.
mean, of course, the problem, majority of the patients who come to the emergency room, which is evaluating over 700, 800 patients in a matter of a week, is many of them are having hay fever or allergic rhinitis because of the pollen count.
Mm-hmm.
And so if you have a little bit of a scratchy throat and the temperature in the 99.9 to 100, that doesn't mean you have COVID. So don't get too frightened
Yeah.
because usually the fever is 102 to 104, intense muscle ache that you've never experienced, persistent hacking cough, and shortness of breath. In addition, the oxygen saturation drops even before shortness of breath in
Mm-hmm.
COVID viruses. And so by the time you come to the hospital, you're pretty sick. So
Mm.
the best is not to get infected. We don't have a vaccine at this point. We're anticipated in March of 2021. And over time, people will get exposed. especially if you're a diabetic hypertensive age greater than 65 for Caucasians, but I think for South Asians age greater than 55,
Mm-hmm.
I think it is better not to get exposed at all. But it is a challenging virus. It looks like it affects a lot of other systems. So we want us to be best prevention is far better than any potential treatment.
Mm-hmm. Prevention is better than cure, as always.
Absolutely, yes.
So I want to thank you, Dr. Sri, for taking this time and really, explaining this all and laying it out so well for us. And I'm sure a lot of our listeners and viewers are going to take away this and hold it, in the future and watch their health as they go along. So
Okay.
thank you so much.
Thank you very much. My pleasure.
Absolutely. And folks, hope you enjoyed that. That was Dr. Komandur Srivatsan of the Mayo Clinic in Arizona, cardiologist, and he really, laid it out for you. So all you have to do is take that first step towards everything that he said, and take care of your health, because the onus is really on you. And you keep listening to Radio Zindagi. Jiye Ja.